everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as mefenamic acid. Its brand name is Ponstan. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So, mefenamic acid is a non-steroidal drug that has analgesic, anti-inflammatory, and antipyretic effects. The exact mechanism of action is unknown, however, it's thought to be related to prostaglandin synthetase inhibition. In terms of indications for use, this medication is indicated to be used in the treatment of dysmenorrhea, or pain associated with periods. It's also indicated to be used for acute, mild to moderate pain. Now, before somebody was to use this medication, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. It would be contraindicated to be used in patients who have a hypersensitivity to mefenamic acid or any other component of the product. It would also be contraindicated in patients who have a history of asthma, urticaria, or allergic type reactions when using aspirin or other NSAIDs or non-steroidal anti-inflammatory drugs. And finally, it's contraindicated to be used in the setting of a CABG surgery or coronary artery bypass graft surgery. Now, in terms of precautions, mefenamic acid is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. We would want to avoid using this medication chronically in the elderly population unless alternative treatments are not effective for the patient and they're able to use gastroprotective agents. This would be mainly due to an increased risk in this population of them experiencing a gastrointestinal bleed. They may also be at a higher risk of developing peptic ulcer disease as well. You would want to use this medication cautiously in elderly patients who have asymptomatic heart failure, and avoid use in patients who have symptomatic heart failure, as fluid retention and exacerbations of heart failure would be more prominent. It should be noted that there's an increased risk of reinfarction if this medication is used following a myocardial infarction or a heart attack. We would want to do our best to avoid this medication in patients who have recently had a heart attack or myocardial infarction. And monitoring will be required if the physician did think that the benefits of using the medication outweighed the cardiovascular risks. New onset or worsening of pre-existing hypertension or high blood pressure may occur. Some medications like ACE inhibitors, thiazides, and loop diuretics may be less effective when this medication is used. Potentially fatal skin reactions are a possibility with this medication, such as exfoliative dermatitis, Stevens-Johnson syndrome, and toxic epidermal necrolysis. The medication should be discontinued at the first sign of any of these occurring. Hyperkalemia or high potassium levels have occurred in patients using NSAIDs with or without renal impairment. It should be noted that edema and fluid retention has been reported with the use of NSAIDs, and that ACE inhibitors, angiotensin receptor blockers, and thiazides may be less effective in treating edema. It's important to note that anemia may occur, and monitoring for this is recommended. There may be an increased risk in bleeding events, especially in patients who have coagulation disorders, or in patients who are using anticoagulation medications. Elevations in ALT and AST, the liver enzymes, to the point of 3 times the upper limit of normal has been reported with NSAID use. We want to avoid this medication in patients who have renal disease unless the benefits of using the medication outweigh the potential risks of making the renal function worse. And finally, for precautions, it should just be noted that asthma exacerbations may occur with the use of mefenamic acid. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use mefenamic acid, they can usually expect to receive their dose through a 250 milligram capsule. If somebody is using this medication to treat their dysmenorrhea, they would typically start off with a dose of 500 milligrams. They would then use 250 milligrams every 6 hours. They would start taking the medication at the first sign of bleeding and symptoms and use the medication for about 2 to 3 days. If somebody is using this medication to treat their fever, they may use 500 milligrams and then use another 500 milligrams every 6 hours as needed. Patients are using mefenamic acid to treat their acute, mild to moderate pain. They can use 500 milligrams followed by 250 milligrams every 6 hours. They would usually try to limit their use of the medication to under a week. An off-label use for this medication would be in the treatment of premenstrual syndrome. These patients would use 250 or 500 milligrams 3 to 4 times daily. They would start the treatment on day 16 of the menstrual cycle and then continued the medication until the 3rd day of menstruation. As with all medications, there are some side effects or adverse reactions that patients may experience while using mefenamic acid, so I'll go over some of those here now. 1 to 10% of patients may experience an itch, and 1 to 10% may as well experience a rash. Abdominal pain, constipation, and diarrhea can happen up to 10% of the time. And heartburn, indigestion, and nausea fall with that same percentage. Dizziness and headache come in between 1 and 10% as well. More serious side effects would be hypertension or high blood pressure, myocardial infarction or heart attack, some of the dermatological reactions that we talked about in Precautions, such as Stevens-Johnson syndrome, hyperkalemia or high potassium may occur, anaphylaxis, cerebrovascular accident, finally, acute exacerbations of asthma. That's all we're going to talk about today with mefenamic acid or Ponstan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.